Hello and welcome to vlog number 95. This week I'm going to talk about Restless Legs Syndrome, RLS, or willis-ekbom disease. So, what is Restless Legs Syndrome? Who gets it and what can be done about it? RLS is a disorder of the nervous system which usually manifests itself as an irresistible urge to move the legs, although it can also affect the arms, trunk and the head. People with RLS have uncomfortable sensations, which creates a compulsion to move the affected body part to relieve the sensations. These sensations are variously described as aching, itching, pins and needles, crawling, electric shocks or muscular tension. Symptoms are usually worse in the evening and at night, and can cause severe disruption to sleep, which impacts upon quality of life. For this reason, RLS is classified as a sleep disorder. Up to 10% of people will be affected by RLS at some stage of their lives. Women are statistically more likely to suffer with it, and it can happen at any age, although it is more common at middle age or older. This condition isn't confined to those with other chronic illnesses such as Parkinson's disease, but the occurrence of RLS does appear to be prevalent in people with Parkinson's, or perhaps that's just my perception. Certainly, the incidence of RLS amongst the PD community seems to be a lot higher than 10%. In the majority of cases, doctors don't know what causes RLS, although a genetic link is thought to be involved. Almost 50% of people with RLS also have another family member with the condition. Other factors associated with the onset or worsening of RLS include Parkinson's disease, pregnancy, iron deficiency. Approximately 75% of RLS sufferers have problems involving iron. Varicose veins, diabetes, fibromyalgia, medications including antipsychotics, antidepressants, anti-nausea drugs and preparations containing antihistamines, alcohol use and sleep deprivation, which sounds like a bit of a vicious circle. There are two main types of RLS. Primary or idiopathic RLS, where the cause is unknown, is the most common. Usually starts before the age of 40, may have a genetic cause, and symptoms may be sporadic or progressively worsen over time. And secondary RLS, which is caused by another disease or condition, usually starts after the age of 45, and symptoms may be more severe, although they tend not to worsen over time. There is no test for RLS, so diagnosis tends to hinge on symptoms, family history, the presence of other conditions such as PD, or medications being taken to alleviate other conditions. Treatment of RLS focuses on the relief of symptoms, and there are many non-pharmaceutical remedies that have been found to have some success, such as regular exercise, elimination of alcohol, tobacco and caffeine, hot baths, ice packs and massage. In 1998, a small study of 10 patients found that supplementation of magnesium reduced symptoms of insomnia in people with RLS. The University of Maryland Medical Center cited this study and suggested that magnesium deficiency may contribute to RLS. Pharmaceutical remedies are dependent upon the individual, but include iron supplements, anticonvulsants such as gabapentin, benzodiazepines which are sedatives, painkillers such as ibuprofen, and opiates such as codeine and propoxyphene. Parkinson's disease medications such as dopamine agonists and levodopa and epilepsy drugs are sometimes used for RLS, as they can reduce involuntary movement. Funnily enough, there's no mention of the medication which I find to be most effective in quelling the symptoms of RLS, without the dangers or side effects associated with the majority of the pharmaceuticals commonly prescribed, and that is cannabis. Whilst a high THC strain can exacerbate the symptoms of RLS, I find that a strain with less THC and a higher percentage of CBD is very relaxing, calms my RLS symptoms and helps me get off to sleep. No doubt, as the legalisation of medicinal cannabis becomes a reality and our healthcare professionals learn about the benefits of this amazing plant, we will see cannabis being prescribed as a medication of first resort. We can but hope. Thanks for watching. If you have any questions or have a topic that you'd like me to cover in future vlogs, just leave me a message in the comments and I'll do my best to respond. Have a great week. See you next Friday.